Hi. Um, so today we're going to talk about the involvement of parents in social skills interventions for autistic preschoolers and how it affects children's outcome. So first of all, I would like to thank my supervisor, Professor Ofer Golan, to thank Dr. Tali Gev, to my research assistants at the Autism Research Lab in Bar Ilan University, and to the clinical team of Beit Echad Centers. I also like to thank the dear families who participated in my study, and to the Israeli Science Foundation for funding this study, and to Professor Elizabeth Logson from UCLA for her support and collaboration. So, as I think you all know, autism is a lifelong neurodevelopmental condition, which is manifested, among other things, by difficulties in social communication. These social challenges may be experienced over and above age and cognitive abilities. And while research supported social skills intervention have shown promise in improving social functioning, there are several challenges remain. Firstly, most existing social skills programs target older children or adolescents, with relatively few evidence based options for young children. Additionally, many programs are limited in how well the skills generalize from treatment setting to other settings like school, for example. And last, but not least, if I might say, only few programs include an active parent component. Meta-analysis across different types of programs, whether group-based, individual, or dyadic, have shown that parental involvement impacts intervention outcomes in both children and parents. As for children, as you can see, they get higher effectiveness of intervention-related gains, and the generalization. תודה. And the generalization of these gains are is better to other settings. As for parents, so they have better responsiveness behaviors. They reported less depression and more positive effect, and they improve the communication with their child. Um, Okay, so this dual benefit underscores why parental involvement is a crucial component of effective interventions. Despite these encouraging findings, there is no study has examined the effect of parental involvement in social skills intervention for young autistic children and by directly comparing intervention with or without parents. So this is what we set out to do. We examined the effect of parental involvement in a randomized controlled trial. The intervention we examined was the preschool version of the well-established peers social skills program, also known as P4P. P4P was developed by Professor Logson from UCLA. It's a 16-week social skills intervention specifically designed for autistic children aged 4 to 7. The P4P includes a significant parent component. During each session, children engage in learning new social skills through multiple modalities, whether it's a didactic lesson or a playing game with the team. Their parents attend a parallel group where they learn about the specific skills their children are working on and how to break these complex social behavior into manageable steps, and how to socially coach their children in everyday life. So children attend their own session and their parents attend a parallel session. And in the end of this 1 hour, children practice their learned skill with each other while the parents coach them and the team coaches the parents in the same time. So to test the effect of parental involvement, we conducted, as I said before, a randomized controlled trial comparing P4P with parents to a modified version with minimal parental involvement, which we called P4P MPI. In this group, children attended sessions, but their parents didn't have a parallel group. But still, parents of both groups received handout at the end of each session. In the handout there is a summary of what they learned in the session, and also homework assignment, which is mainly having play date and practicing the skills we practice in the group. And we predicted that children in the P4P with parents will demonstrate higher gains compared to children in the P4P without parents. We also predicted, based on previous studies, that the generalization of child intervention related gains will be better in the P4P with parents group compared to the P4P without parents group. Okay, so these were two predictions. So we started with 74 children who met eligibility criteria, meaning they scored above cutoff in the EDOS-2, had no cognitive deficits, and expressed social motivation in the clinical interviews. They expressed that they wanted to make new friends. They were randomly assigned into two groups, P4P with parents and P4P with minimal parental involvement. Groups are comparable on demographic and cognitive measures. Participants were assessed at the beginning of the intervention and immediately at the end of it. We had 69 participants who completed the intervention and were assessed both times. I want to add that parents in the minimal parental involvement condition participated after all the study assessments in an intensive 4-session seminar. During this seminar, they received the same educational materials as the P4P with parents and had opportunities for questions and feedbacks. We used several questionnaires to measure our outcomes. Parents and teachers filled out this, okay, there's a lot of S here, so the Social Skills Improvement System, the SSIS, which looks at social skills and behavior. They also filled out the SRS2, the social responsiveness scales for social challenges that related to autism. And parents alone also filled out the Parenting Stress Index, the PSI. And now for the results. So, analyzing questionnaires, we've found that only parents in the P4P with parents group reported significant improvement in the social skill scale of the SSIS and the assertion as SSIS subscale. It's the red line. Okay, without that. In addition, only in the P4P with parents group, they reported significant improvement in the self-control and subscale of the SSIS, and they reported reduced autism symptoms after the intervention. Notably, both groups exhibited elevated parental stress, but it was statistically significant only in the P4P without parents condition. As for teachers who were blind to the child RCT condition, they knew the children are participating in intervention because they filled out the questionnaires, but they didn't know whether they were in the with parents condition or without parent condition. They revealed a more complex picture. For both groups showed improvements, but as you can see, the effect was greater for the P4P with parents condition. This is in the SSIS social skill scale. It's a total scale. And moreover, the patterns between the two groups differed. So in the P4P with parents group, they showed significant gains. These are all SSIS subscales in communication, responsibility, and engagement subscales, while the group without parents improved significantly according to teachers' report in empathy and self-control subscales. As for the SRS2, which we didn't find in the parents' report, in the teacher report, we found that only in the P4P with parents condition, teacher reported significant improvement in the SRS total score, in the social communication and interaction scale, in the social awareness scale, and in the social cognition subscale. On the other hand, for the P4P without parent condition, teacher reports indicated significant improvement in social communication and in restricted interest and repetitive behavior subscales. So first of all, I think it's encouraging to see the teacher reported improvement in both groups, and it makes sense because all children participated in an actively skill learning. However, it's important to notice that the improvements are more robust in the P4P with parents. Teacher reported significant change in more subscales and in the overall scale of the SRS2. And as you can see, the size effects of the P4P with parents are greater compared to these of the P4P without parents group. So to conclude, our findings underscore the role of parental involvement in a child-focused social skills intervention for autistic children, as concurrent with previous studies. And second, the generalization of learned skills to school settings improves more robustly when parents are actively involved. And finally, this study is the first RCT evidence for supporting P4P. Thank you.